I really got interested in cardiology in medical school. It was the unit I remember the best. It made the most sense to me because of the physiology, but also a core focus on research. And both of those really aligned well with what I was interested in. My subspecialty is preventive cardiology, which focuses on the prevention of cardiovascular diseases, especially atherosclerosis, or what we commonly call heart disease. So blockages in the arteries of the heart, for example. The most important thing is A, to convey to patients what their risk of heart disease is, in our opinion, and B, learn about their values and their approaches to life and what they want to accomplish in life and what their concerns are about their own heart disease risk, and hopefully marry those two to come up with a management plan that works not only from a medical standpoint as being appropriate and according to the guidelines, but also from the patient's own individualized values and overall goal standpoint, because that's incredibly important when it comes to something like prevention. Oh, it's incredibly fulfilling and it's incredibly joyous on my end to empower patients to learn everything they can about their own risk factors and really have them drive their own lifestyle changes, their own medical changes, whatever it be. And I'm there as a consultant, as someone who's there to answer complex questions, who's there to step in if something happens and things like that. So establishing that kind of lifelong relationship is really incredible. It's never the wrong time to come to preventive cardiology because we want to start early. We take patients on a journey where the risk for having an emergency is as low as possible. Patients who had no idea that they had risk factors, they had no idea that certain risk factors were abnormal. We come in, we treat them, we get their families screened, and just providing that level of information and empowerment, being that kind of conduit to be able to do that is incredible.